Choking. Now, choking is not a common cause of death, and it is treatable. People are most likely to choke when they're eating and where they are often in company. As victims are initially conscious and responsive, early intervention can save a life. Recognising that someone is choking, though, is the key to a successful outcome. So do not confuse this emergency with fainting, heart attacks, seizures, or any other conditions that may cause a sudden respiratory distress and lack of consciousness. As we said, choking usually occurs while the victim is eating or drinking, and people at increased risk of choking include those with reduced consciousness, people that are intoxicated by drugs or alcohol, some sort of neurological impairment with reduced swallowing and cough reflexes such as strokes or Parkinson's or dementia, or maybe even dental problems, and also older age. Now, there's two types of obstructions somebody might have. There is partial blockages and full blockages. Now, with a partial airway obstruction, blockage, this could be something like a fishbone. It's caught in the throat, it's causing them severe pain, discomfort, the person's coughing a lot, they're getting very distressed, very tired, and the face is very red. So with this person, we're going to go up to them, as we do with anyone else who's choking, and we ask them the most obvious question, are you choking? If they can say yes they are, they're not really choking, in a sense of a complete airway obstruction. So this person has a partial airway obstruction. We need to allow them to cough. We need to try and calm them as much as we can, and hopefully they'll clear the obstruction themselves. But the most important thing to remember is that person is breathing. There's nothing else blocking their throat. However, if they went to eat something else, then that could become a complete airway obstruction. A complete airway obstruction might be someone eating a bit of steak that's got stuck, a grape that's not been cut up. And when it's got completely stuck in their throat, they won't be able to talk to us. So when someone's got a complete airway obstruction, that's where we need to go through the manoeuvres we're going to talk about now. These manoeuvres are back slaps and abdominal thrusts. When someone's got something stuck in their throat, they can't actually get air past it. So they're going to do what's called the universal sign of choking. They'll take their hands to the throat and they'll gasp. They can't make any noise. They're going to look very panicked, very wide-eyed. They can look very scared. Sometimes they'll start to look blue as the oxygen levels start to drop, or the face will go pale depending on what skin colour they have. Sometimes what they'll also do, they'll be embarrassed. What could happen then is the person may leave the room. They may be going to the toilets, or they'll go outside. So if you see someone who's choking has suddenly left the room, please follow them, because they need some help, because once they get to a point when they collapse, they will need CPR. And if they go by themselves, they will collapse and they will die. So as soon as you see a person is panicking, they're holding their throat, they're turning blue, say to them, are you choking? We need to allow them to cough. We hit them up to 5 times between the shoulder blades with the heel of one hand. We make sure we check to see if the blockage has come out. So we don't just hit them randomly 5 times. We hit, we check, we hit, we can check. Now the idea of these back slaps is hopefully to dislodge the item so they can expel the air out of the lungs and the item will hopefully come out. However, when you're doing the back slaps, always look forward to see whether something actually is coming through. If that still doesn't work, what we need to do is called an abdominal thrust. So we're aiming for the bit just underneath your rib cage, but above your stomach muscles. Right here, so underneath the rib cage, above the stomach muscle, other hand at the top. And what I will do is an inward and an upward motion. Okay, this is called an abdominal thrust. And I'll do up to 5 of these. If that still doesn't work, that's my second one. Checking them out each time. Obviously I'm not doing this for real because this person isn't choking. And if I do this for real, it actually causes some internal damage. Up to 5 of those. If that still hasn't worked, I turn them around again, and again I repeat the whole cycle. Up to 5 back slaps, up to 5 abdominal thrusts. I do 3 cycles of this, then I will call 999. the casualty is probably going to go unconscious by that point, and that is when I need to be able to begin CPR.